Preclinical Skills 2. Assisting with forceps extraction. You will need You have 20 minutes to complete this skill.
Vitals are taken prior to extraction. The mirror is handed to the dentist to examine the tooth. As well, the radiograph will be on the X-ray viewer. The assistant will place the topical anesthetic. And the local anesthetic is handed to the dentist and administered. An explorer is handed to test for anesthesia. Once anesthesia is achieved, a Minnesota as well as the periosteal elevator are used to expand the gingival tissue around the tooth. This helps with bone expansion. Elevators are then used to luxate the tooth. Once the tooth is ready for extraction, the forceps are handed. If it is a mandibular tooth that is being extracted, forceps are handed this way. If it is a maxillary tooth, forceps are handed in this manner. Please note the curve adapts to the dentist's thumb. A surgical high volume suction is used to remove blood. Tooth is extracted. As it's being extracted, a gauze is placed over the tooth so that the dentist can examine the tooth afterwards to make sure that all the tooth is intact. A curette is used to clean out the socket. Rongers are used to remove any sort of bone file pieces. And a bone file is used to smooth off any sharp edges. A damp gauze is placed over the extraction site, and the patient is instructed to bite firmly down for 30 minutes. The patient will then be seated up for postoperative instructions. In the case of multiple extractions or a surgical extraction, a blade may be needed. It will be handed carefully to the dentist, and the Minnesota will be used to retract the cheek. Surgical high volume is used. The blade is handed back to the assistant and properly placed. If sutures are needed, the assistant provides retraction for the cheek. While the dentist maintains control of the needle on the sutures. Once the stitch is placed, the assistant will be required to remove the excess suture with scissors. The dentist then should clasp the sharp end of the needle.
So we just extracted that tooth for you, and I'm just going to go over your post-op instructions. You're going to be biting down on the gauze pad in your mouth for 30 minutes. If bleeding continues, take 2 gauze from the package that I'm going to give you, and you're going to lightly moisten the gauze with some tap water and place it over the extraction site, and you're going to apply a firm biting pressure on that area. A moistened tea bag could also be used if there's no gauze available. Do not disturb the wound or the extraction site area. In doing so, you may cause irritation, infection, and additional bleeding. Avoid smoking and consumption of alcohol for 24 hours. Avoid rinsing for 12 to 24 hours. After 24 hours, you can begin to rinse with warm salt water, half a teaspoon of salt and a glass of warm water. And you can swish with that several times a day. It's important to rinse after each meal and before bedtime. You can also apply an ice bag or a cold towel to the area, 10 minutes on, 10 minutes off for the rest of the day. Complete any medications prescribed by the dentist. If sutures have been placed, they will dissolve in 3 to 7 days unless we tell you otherwise. And if bleeding persists or have any concerns, please call the office.